And to talk about it further, I'm proud to introduce our conference chair, Elise Stefanik.
Thank you so much, Whip Scalise. Just as a reminder, we were here with the Docs Caucus just 2 weeks ago. These members have been active throughout the COVID crisis, sharing their medical expertise, sharing their policy expertise. And I want to publicly thank the members of the Republican Docs Caucus for this leadership, these policy proposals, and this expertise throughout the crisis. From delivering vaccines to the American people, to their public service announcements encouraging vaccines, and of course their important work to follow the facts and the science to investigate the origins of COVID when Democrats have refused and failed to do so. I also want to take this moment to thank my local county public health officials and providers in my district who have worked hard to educate and answer questions and serve the public. Some of the most rural counties in New York's North Country have been nationally recognized for their leadership and vaccine rates throughout the pandemic. Americans across the country know we cannot afford another shutdown. We need to keep our schools and businesses open, and we must remain focused on getting answers as to the origins of this devastating global pandemic. Every American has been negatively impacted in some way by the COVID-19 virus. The question is, why are Democrats stonewalling our efforts to uncover the origin of the COVID virus? Why are Democrats not investigating the growing list of evidence that leads us directly to the Chinese Communist Party and their cover-up? And why is this administration refusing to hold China accountable? Our Republican members will continue to work to demand answers and accountability and transparency for the American people, and the GOP Docs Caucus is leading the way. And I'm proud to turn it over to one of the co-chairs of the Republican Docs Caucus, Dr. Andy Harris.
Thank you very much. Today, before we talk about the origins and where we go from here, let's just summarize a little bit about the Delta variant and the vaccines. Look, the Delta variant is with us to stay. We know that the vast majority of new cases in the United States are Delta variant. That's the bad news. It's a more transmissible variant. The good news is it looks like it's no more virulent. That in fact, if you look at deaths and hospitalizations, it's probably no worse than the original virus or the variants. Vaccinations in a study just published yesterday in the New England Journal of Medicine, two-course series of vaccinations does protect against symptomatic infection from the Delta variant. So members of the Doc Caucus, like myself and others, have been vaccinating patients, have been participating in clinics, getting the message out that if you are at risk, you should be getting this vaccine. This vaccine does, in fact, protect against symptomatic Delta variant, and we continue to deliver that message. We urge all Americans to talk to their doctors about the risks of COVID, talk to their doctors about the benefits of getting vaccinated, and then come to a decision that's right for them about the vaccine. With that, I'm going to turn it over to Dr. Miller Meeks to talk a little bit more about the source.